Hi, my name is Michelle, and I want to talk to you about an adolescent I just met with. Her name is Aria Grant. Aria is a 14-year-old female who presented this morning, accompanied by her mother, with a sore throat of 3 days duration. Her sore throat has been progressively worse. She says she had a fever and nausea overnight, so her mother recommended she make an urgent appointment with the clinic to get seen today. I have not met Aria before, however, she reports being a patient of yours, and she is seen annually for routine visits. After talking with Aria for some time, I understand that she is a generally healthy individual, apart from having strep throat as a child, for which she was diagnosed in 2012. She was initially treated with moxicillin, however, soon switched to cephalexin due to the development of a rash beginning days into therapy. The onset of Aria's symptoms began upon waking 3 days prior to her clinic visit this morning. She described symptoms at the time as noticeable irritation in the back of her throat that worsened over the past 3 days. This morning at 1 a.m., prior to clinic visit, she reports her throat feeling especially scratchy with a sharp pain when swallowing. That was when her fever and her nausea started as well. The pain is localized to the back of her throat with no radiation, and she describes it as constant in duration, though worsening with swallowing. Some aggravating factors for her include swallowing hard foods. Aria reports finding some relief with popsicles and gargling salt water. She rates her pain a constant 6 out of 10 using the pain scale chart and 8 out of 10 with swallowing. Aria reports associated nausea but has not yet vomited. She did try some Tylenol extra strength at home, provided by her mother, though did not feel much relief from pain. However, it was effective for her temperature. Aria states she is unable to compare her current pain to her experience with streptococcal pharyngitis, as she was only 6 years old and cannot recall, though her mother says her symptoms were similar at that time and that her brother just got over strep throat roughly 10 days ago. This is Aria's first visit for her sore throat that started 3 days prior. Aria is not prescribed any medications and currently does not take any medications besides the Tylenol extra strength that she had last night at 1 a.m. Her only known allergy is penicillin. Her only pertinent medical history includes prior history of strep throat as a child and her brother who lives with her recently recovering from strep throat. She is otherwise healthy and has no further family history of conditions. She is speaking clearly, no drooling, no stridor, denies difficulty swallowing, only associated pain. Aria is in no apparent respiratory distress. She denies any abdominal pain or extreme fatigue. In 2010, Aria reports being diagnosed with strep throat. She was initially placed on amoxicillin 500 milligrams PO BID, though developed a rash soon after therapy was initiated, and was then placed on cephalexin 400 milligrams PO BID for 10 days. Aria's symptoms fully resolved after treatment. Aria lives at home with her mother, father, and brother. She reports having an extremely supportive family. She is currently in grade 8 and attends junior high school, though has been absent from school since the start of her symptoms. She reports not being in a relationship and denies any sexual activity. Aria denies smoking. In fact, she denies any substance use at all. Aria arrived in no apparent distress, well-groomed, pleasant, and arrived with her mother. Her vital signs were normal, though she reports feverless AM by thermometer, followed by Tylenol extra strength. An HEENT exam, lips were moist, no cracking, oral mucosa was pink, no nodules, masses, or lesions, no excessive salivation noted. Her gums were pink, her hard palate was pink with no lesions or masses, tongue was pink with small white patches near the tonsils. Pharynx was red, inflamed with small white patches on the pharyngeal wall, the posterior pharyngeal wall. Her soft palate, her uvula was red, but it was midline. Tonsils are noted to be grade 2 plus, red and inflamed, with exudate and notable white patches. I did note 2 soft, tender, mobile left tonsillar nodes measuring 2 centimeters in diameter. I also noted 2 soft, tender, mobile cervical nodes in both right and left anterior superficial cervical chain, each measuring 2 centimeters in diameter. There was no posterior cervical lymph node adenopathy. Her temporomandibular joint had no swelling, redness, or tenderness, with a smooth range of motion. Ears were unremarkable, no tenderness or nodules. Ear canals had no discharge. Her tympanic membrane was translucent, pearl gray. The color was pearl gray, as I just said, and the malleus and cone of light were noted. There was no bulging and no perforations identified. On respiratory exam, I noted absence of cough, and she denied the same. There was no audible adventitious sounds, no stridor. I auscultated her chest for equal and clear breath sounds bilaterally. On abdominal assessment, the spleen was non-palpable. The liver edge was 1 centimeter below the right costal angle. It was regular, smooth, uniform, and non-tender. Her liver span was about 6 centimeters, and she denies any abdominal tenderness. To summarize, Aria is a 14-year-old female who presents with a sore throat that started 3 days prior to her clinic visit. She initially described her sore throat as an irritation to the back of her throat that progressed to a scratchy feeling with a constant pain of 6 out of 10, increasing to 8 out of 10 on swallowing. She had no relief from Tylenol, but mild relief with gargling salt water. Her brother, who lives with her, was recently diagnosed or treated for strep throat about 10 days ago. This morning, prior to her clinic visit, Arya reports fever and nausea. Her significant medical history includes strep throat as a child, for which she was initially treated with amoxicillin, though developed a rash and was soon placed on cephalexin. Thus, has an allergy to penicillin. Arya denies any sexual activity. She denies difficulty swallowing, denies abdominal pain, is in no apparent respiratory distress, denies drooling and is speaking clearly, and denies extreme fatigue. Her exam reveals grade 2 plus tonsils that are red and inflamed with exudate and white patches bilaterally. Her pharynx is also red and inflamed with some white patches on the posterior pharyngeal wall. Her uvula is midline with no deviation. She has 2 tender mobile enlarged left tonsillar nodes and 2 tender mobile enlarged anterior superficial cervical chain lymph nodes bilaterally. Her ear exam is unremarkable. Her tympanic membrane is translucent, pearl gray in color with the malleus and cone of light easily identified, and no apparent bulging or discharge. Respiratory exam is remarkable for clear breath sounds bilaterally, no stridor. Abdominal exam reveals no tenderness on light or deep palpation, as well as no apparent splenomegaly or hepatomegaly. Thank you, and I look forward to further discussing my findings.